Guru Nation, the power of branding. I'm here with Yvonne Lemaroo, my Canadian buddy, Canadian brother from another mother. I've known you for what, 8 years, 7 years?
Yeah, that's about right.
Who's counting? We traded book recommendations many a times. What have you been reading lately, man?
Oh, that's a great question.
That's a off the wall question. I got a few ones for you.
Yeah.
Yeah, I
Uh,
got a few.
Scale is something I was reading recently. Where is it?
Gail?
Scale. Yeah. It's not exactly the newest book. I haven't read that much recently. Usually I've been reading a lot.
Okay.
There's the Brand Gap that I revisited recently. Yeah, I don't know. And it's strange, but we're right now in a period of a lot of work. So all of a
Mm.
sudden my nose hits the grindstone. And usually this time of year is when we're seeing a lot of activity right before Christmas.
Yeah. Well, happy holidays to you guys watching from the future. And then even more in the future, happy New Year to those watching. This is evergreen, Yvonne. So, branding,
Yeah.
you focus a lot with your organizations on clinical research branding, particularly for sites, but
Yeah.
you've worked with sponsors and CROs. And prior to getting into this industry, life sciences, you've been in the consumer packaged goods
Yeah.
with beers. What was it? Blue,
Yeah. Coors, Labatt's you may know of, like
Labatt's.
Blue,
Yeah.
Ted. Yeah, did a very short stint. For ethical reasons. We got out pretty quick. Um,
Mm.
Having to do with the tobacco industry, like, but that's gone the way of the dodo bird for a lot of things. But we've done things for like Little Caesars,
So you
Pepco.
understand the consumer mind very well. The analogy in our industry is patient, right?
Yeah,
Consumer,
and
patient.
that's just it. Like we've set up recruitment sites, websites,
Hmm.
by which people can join a research trial. We've done work in and around branding clinics, and creating awareness for branding individuals, uh, and promoting their expert opinion. For instance, whoever the lead physician is, or site owners, to help them grow their reputations, both in their direct community, but at a national level. It's sometimes international, right? We've done
Yeah.
work in Australia, Canada, and the US primarily.
This branding stuff is like, I mean, I've seen it play out in my own career. Um, the power of branding. So I was a site owner before I ever became a YouTube for about 5 years, actually. And 5 years in, the business started to scale, and I started looking for, okay, well, how do we differentiate? What else is there? I think I got this figured out. I like growing and building. I don't like managing, is what I've realized. So part of that ADHD trait that I have is, I mean, it's a gift and a curse because I'm able to catch on to things quicker, I think. And there's a lot of blind spots as well if you operate this way. But one of the things I caught on very early was my boy Gary V. In 2009, I read his book Crush It,
Mhm.
and he talked about building a personal brand and extending it to your business. So he did it with wine. And he had a liquor store, and then he was switching it to online, and he started doing a wine vlog on YouTube.
So here's the thing, there is a difference, and it is a choice.
Yeah,
You can develop a personal brand, which is
yeah,
very much today in terms of what people do because of social media and all these touch points that we have that weren't there, say, 30, 40 years ago.
hmm,
A traditional brand approach also has value where it goes beyond the individual. When you develop a personal brand, you're always tied to the brand, like your
yeah,
faith. You have to be there for events and so forth. But if you wanted to develop what is more a traditional brand, like something, an entity outside yourself, now it doesn't have to be Tony the Tiger or Mr. Clean, Those
Hmm.
are brand reps, as images of. Well, what you're doing is you're creating something bigger than yourself. For instance, if you're not going to go with the lead physician, or if they, for instance, don't want to be the center of attention or can't make it to too many events, it's really about the brand, the clinic itself, and developing an image, a voice, in other words, a way of speaking to the community, both officially and unofficially, through the various channels, to
Yeah.
help promote a trusted, how can I say, expert opinion.
Yeah, and awareness. I agree with you. There's the personal brand, there's the company brand, and if it's a small enough business, there's a lot of overlap between the two, right? Because
Correct.
even with us, like we do it with Yuma Clinical Trials, and this will be a topic at SOS 2025 March, Oklahoma City. Get your tickets, guys. What the heck is going on? SaveOurSites.com. Make sure you book at the Omni Hotel. I don't want to hear Airbnb anymore. We gotta sell these rooms, man. This is getting serious.
It was
Ivan,
a great event last season. I had a great time.
thank you. Yeah, Ivan was there. We were chilling afterwards at the after party, man. Things got wild, but Ivan was there. The stability of the whole show, holding it down. Ivan was the voice of reason. Uh, when things got wild. Brand, so I have my own personal brand, right? Because of Gary Vee. So to me, I didn't need to be sold on the fact that this works. I've lived it, my own career. So when I came to Yuma Clinical Trials, to me it was a no-brainer. As soon as we start generating cash flow and we're able to pay our bills and all that, we're gonna take just a little from the profits. It's not a lot. It's like 1,000 a month max. It's not a lot of our profit margin.
Mhm,
And reinvest it into our Instagram, our YouTube channel, and really and our Facebook. Really, those three things. By creating a piece of content every month, like a long form.
mhm,
It's
mhm.
usually a
Pillar,
30-minute
pillar.
podcast. Pillar
Yeah,
content.
yeah.
Now, that's our community brand, and I make it a point to not be in every video on that. Although it's tough because like I kind of know how to do it. So when we want to get something done fast, everyone's busy. I'm like, all right, I'll do that one.
Yeah,
But
and
now I've been,
you have a natural aptitude for it too. Not everyone does. Some people cower in front of
yeah,
buttons, right? No
yeah,
matter how
yeah.
educated, how accomplished they are.
Yes. We've had our coordinator, so it's me, Katie, Grecia, Lana, Luis. There's five of us, and Jaime. Jaime is the one, he's my NP, who hasn't been. I gotta get him on one. He's on my channels a lot, but he hasn't been on our company, Yuma Clinical Trials, so that's next. But for the most part, we're good. We're all interchangeable. We've already started getting like traction in the community from doing this. So,
Mhm.
but to your point, nothing like this really exists in our industry, and I'm not sure why. And you've looked under the hood a lot. So can you tell me like
Yeah.
why?
One of the things we observed was oftentimes, like at a clinic level, when you're doing research for various things, like you might have particular staff that's skilled at a uh, particular indication, and or equipment, right? Specialized equipment. But there's this notion out there that we want to be open to as many types of research trials as possible. Whatever's coming down the pipe, we want to be part of. Seems to be the case. And a lot of times, like people or teams don't realize that it's really about creating context for those research trials. You can choose to specialize or say that you specialize in something. So you have further resonance within the community and that more advocacy groups want to take part in what you're doing. Or you can keep it kind of general and try to basically promote your personality within the team that makes for a warmer welcome when potential patients arrive. There's different levers that you can pull, but there are choices to be made. Oftentimes, what we observed was clinics just let the trials dictate what they were about and nothing more, because
So they
because it is,
become
yeah.
their trials,
Exactly.
essentially.
And the second thing is oftentimes that this notion that the lead physician or the owners themselves, whether, whoever they are, their personality, much like, doctors, they don't necessarily believe in branding, it's their name. Their name functions as their brand. You could call it the first personal brand, right? Long before there was personal branding and social media, such as we just discussed. Their name, much like a lawyer, is the authority. And there's nothing wrong with that. But you have to provide it further context if that's the way you're going to go. When you have a team of physicians at a clinic, and it's a much larger clinic, that becomes murkier water. You want to have certain tenets of your brand, like what you guys are about. And yeah, you can do a mission and a vision and so forth, but
Mm.
branding is really about how you're living it in your materials, in your
That's so true,
conversation.
man. That's so true. And there's so many like real world applications to this that and variabilities. So let's take my site, Yuma Clinical Trials again, because that's the only one I know well to speak of. One of our PIs, one of the most respected physicians in all of Yuma, right? And he was
Mhm.
the first one we partnered with. He's our internal medicine. He's got one of the biggest private practices in Yuma. His name is like gold, like his reputation, the way he acts, and I can tell doing research with him, the way like he truly cares about the patients, but he's also built a really good private practice. Now, so he has a brand in the town,
Yeah.
but we've been doing research for 3 years. He doesn't have a brand about research. His patients are still surprised when he tells them, yeah, we have research studies. So that's where we got to come in somehow.
Yeah, and part of it too is understanding where, like, he might be managing effectively what traditionally is called different uh, areas of business or categories or funnels or but the point is you have to contextualize these things and provide like an online website. It could be just a landing page that
Mm,
describes that piece of the business, right?
I
And a
see.
lot of time there's a lot of very cookie cutter solutions out there in terms of the clinical trial industry, in terms of their websites and so forth.
Yeah.
Uh, and they're made generic. One of the things we also encountered is the research trials themselves, because you can't make promises, because you can't say too much of any one thing. It becomes a mirror to the clinic itself, and they're scared to express anything at all of any nature.
Right.
Uh,
And so you don't say anything because it's
exactly, and they keep it, and they think, well, that's clinical, right? Let's get like the beiges out there, the grays out there, the clinical greens, whatever the smocks are of the day. Those are the colors we're going to use. And I mean, you do need a certain amount of integrity, and there is something to that, but you can treat it, you can be more creative, you can have more personality and still be a respected clinic in the
okay.
industry.
I got a perfect idea. This just came up and I'm gonna put you on the spot, put myself on the spot. Just high level, you haven't looked at this yet. I wanted to share my website, and like you critique our brand. I'm a tough guy, Ivan. You can tell me it's shit. Like it's not gonna ruin my day. I'm not gonna hate you.
Okay.
Um,
I'm
so
seeing it. You're gonna have to command zero your screen so it's at scale.
no, because this
Oh,
is the
okay.
part that's bad about it already. It's this background. I need to change this. So far, everything I did myself.
Yeah, yeah,
Um, so this is our website. We have the first thing that we did. We invested in this video. I'm not gonna
yeah.
play all of it, but it's like a 14-minute video where
Okay.
we go through all of our clinics in the community, like all of them. We
Yeah.
introduce our staff, the doctors, and so like it's like a 14-minute tour, and then it's meant for sponsors as well. It shows what we have in the sites and all that
And this is
stuff.
a landing page specific to that task is in drawing
Yeah,
interest.
this
Yeah.
is our homepage, like Yuma Clinical Trials. So like when we do like a YouTube video about, interviewing a taco shop, and I'll get to those. Um, this is like where they come first. So they'll see who we are, and then the first thing they'll see is like this video,
Mhm.
and then we kind of get into just some generic stuff about what we do and the different entities. For this, more for the sponsors, pictures. What do you think so far though of like the
Well, there's
strategy or the
not,
brand?
I think the strategy is on point. I think the execution needs some work. Like,
Okay.
there's not enough difference in type hierarchy. Like,
Mm,
Yuma Clinical Trial has no personality outside of a font. And you want some sort of logo form for that because it's
uh,
supposed to act as a signature to a page, lending its credentials to the page.
okay.
The other thing I'll say is the background you're using behind the video is very busy. It's distracting, and you can't make out what it says really. So it
Yeah.
has no value. I understand that, oftentimes graphics and corporate graphics, such as a logo, are used to provide, how can I put it, some visual element of interest. But because you have multiple colors back there, it's distracting to the image in front.
Okay.
And you said it's a 14-minute video. Is it a landing page, like one page?
Uh, yeah, this homepage is one page. Like we
Okay.
have different
So
pages.
you probably want a 30-second video, and then when they scroll down and read and they want to do a deeper dive, they catch this.
I
The
see.
A home page is made to peruse. It's like a hyperindex, right?
Okay.
And
So you're saying the full length one in the About Us page, maybe?
yeah, that would be sure. And the other thing is your navigation is very complex. And if when you reduce that to a phone, technically it might be hard to tap because some of the nav
Ah,
is close together.
I
Like those are
see.
just technical things. But
Mm,
the message is on point, and what you're trying to achieve is on point, given what you're telling me, to be the case, right?
okay. Like key staff.
Yeah.
These
Well,
are
your
the
buttons,
IPIs.
for instance, those are hardly legible now. When that gets reduced further, it'll be even harder.
Yeah. And this is good that we're going through this because I could tell you the majority of small sites do it themselves and have
Oh yeah.
something similar. And then
Yeah.
these are like the indications we typically do. Contact us. What do you think about this so far?
Well, I mean, visually, it's all that type's a little overwhelming by itself. You could have a slider and have three of them at a time rather than
Uh,
what you want to do is create a lot more white space. So in this case, we can talk about white space with the contact us there. There's a big gap of white. That should probably, be made narrower above the next copy. So contact us, scroll down or up, sure. That's about right. But like these are just design elements of the brand, right? Like you
okay.
want things, the copy needs to be the body copy needs to be made larger. That's
Yeah.
far too small. And rather than using a thick header, maybe use a taller, skinnier font for sounds.
Like
Uh,
this?
yeah, well, even that, because everything is so, you don't know what you want to guide the eye in terms
I
of what
see.
you're trying to put together. And
Okay.
one, like, we are committed is left justified, and then you have center justified. We are our clinical, whatever the next paragraph is.
Yeah.
Uh, you should probably left justify both. You need to know when to apply convention and when to break from convention. Like there's a
Yeah.
lot going on, and one thing you want to avoid are backgrounds that make it harder to read.
Which is what this is.
No, that one's all right
Oh,
because
this
it's
one's okay. Okay.
in my mind, but there were some
Our
other
home page is hard. This is
yeah,
hard.
and that's their first impression.
Yeah.
So
I
this
think,
is directly in line with what we're talking about, like creating the
yeah.
right impression and earning people's trust from day one.
And that's why I w decided to like do this. Like, so this is like for sponsors and CROs. This probably the video should be here, that 14
Probably
minute video. And then each indication just has a brief bio of the PI. That's something simple.
that's
Uh,
perfect.
you think that's good?
Yeah, the PI, that's
Except that
perfect.
our heads are cut off here, but
Well, in this case, these are all technical issues, right? Like,
yeah,
here's the thing: I'm an award-winning designer, and I've got guys, who know what they're doing, and
we might need you guys to fix this. But this is like my favorite part is this community videos.
yeah,
So community showcasing like who we are, Each one of these is like this is the one I was showing you, the one that's all Spanish, 30
Okay.
minute pod with
Yeah.
and then they'll cook like a ceviche on this one.
But you're adding personality and context to who you are within the community, right?
Yeah, yeah. This is the part like besides the technical stuff, we obviously have to fix that, which
Yeah.
I'm happy to talk with you about. But the branding, like, well, it's all branding, right? But the I guess the like this things, like for lack of a better word, this community just giving back. Like here's a more shrimp taco owner restaurant. This is hyperbaric red light therapy guy. This is one of our PIs goes to Yuma Fight Leagues and he's the cut man for the event. So we have like UFC. This is like he's like popped someone's shoulder back into place in this video. These are some credit people. This is hospice. So like we get it. Nail salon. This one went viral. This girl right here, Jenny, she does nails. Like the most
So
popular
this
person
is
in Yuma.
this is like it's like a potpourri of personalities here. But the thing is, what you're showing is community outreach. You're showing that you're involved in the community and you're willing to engage. And the thing is, with clinics, they're often seen as sterile, evil places. There's
Yeah.
there there's a stigma about research, as we all know. And this is a way of humanizing your brand, right? And showing, and you're borrowing trust basically from all these other entities you're interacting with, right?
Yep.
And this is how all of a sudden someone who went to that nail salon who would never consider it a research trial says that, oh, research trials exist. And hey,
Yeah.
I've been having an issue, a psoriasis or eczema or, cancer,
Yeah.
they're all over the map, right?
And
And
this,
these people
you're
look like
right.
someone I can trust.
That's the part where I think other sites can do better, like when it comes to this stuff. This is
Yeah.
not that hard to do. Like it looks difficult. I mean, yeah, you got to take an hour of your day to go interview. In this one, look, I'm not in this one. I'm in this one. I'm in this one. I'm not in like half of these.
Mhm.
Which is the point. Like back to your point of personal branding, but the thing that the biggest part to me is all these things live off of our website too. Like these live on YouTube, these live on Instagram, these live on Facebook, where they have a life of their own.
And they're
It,
evergreen. You said that earlier. Use that
yeah,
language.
yeah.
Maybe you should expand on that.
It's never gonna get like there's no trend involved. It's never gonna be not relevant as long as that business is still around. Like Jenny's gonna be Jenny, who the nail salon lady there, she won Yuma's best nails. That girl, Ivan, that girl is booked like more than the doctors. You can't get a spot with her. And like when she reposted our Instagram to her story, our we got like 200 followers overnight from her fans.
And you know this through practice, I'm sure. You recognize that those same people who are willing to do this type of activity with you are also struggling to put together content, something unique, a message, right?
Yes.
But
Yes.
really, it becomes a collaboration and one that you can revisit maybe next year, or whenever makes sense.
Yeah. Now some of them are getting smart though. Like Jenny has, she does vlog.
Mhm.
She posts like nail spam, she calls it, and they do a good nowadays they do like some of the businesses do their own marketing, but it even more so because then next time you interview them, they're basically renting out their audience for you, and then some of those you keep, and then some of those people, hey, I watched you on with Jenny. I get my nails done with Jenny. I also have depression. Since you're associated with Jenny, you can't possibly be a con artist. Because Jenny, I know Jenny. That's the mentality. Like Jenny
Right.
wouldn't partner with a con artist even on a 30-minute video.
Yeah, no, and I think like that's you're borrowing from each other's integrity, absolutely. Also, the way we often work with teams who do a piece of their own social, but we come in like superheroes. We come in, we do a quick fix, we sometimes provide guidance, and we leave. And we have plenty of clients who come to us like, the relationship is like once a year. It's not a month over month, right? So there's different levels of branding, and we always encourage people to do a certain amount of their own communications online. It's more authentic, and people, that's what they want to see, is a certain level of transparency with the business they're about to spend money with. That's a big part of what branding is about today.
When you have conversation with sites, that's the also what makes it difficult for sites to pull it off effectively. Because like in these 30-minute videos, we the temptation is to talk about ourselves, but you're actually interviewing someone. So
Correct.
you're supposed to let them talk about their business. And people are like, well, what's the ROI in that? And to me, it's obvious. I can't really articulate it well, but the ROI is in the attention. Like they're watching that. They wouldn't have watched that if you just put something out on your own. But because
Correct.
you're interviewing that business that's a staple in your community, people are like searching for that. Like, oh, let me look up Burger Theory, see if they have any YouTube videos, and boom, here's a 30-minute interview with their manager. Like, yeah, it's interesting shit if I'm somebody interested in that restaurant.
Yeah, absolutely. They want, like, there's weird people fill time with videos, they use them to educate themselves. Like video is no long, it's the new conversation, right? People would, and here's the other thing. People would, there's two things, education and entertainment. If you could marry the two, it's the ideal combination. A form of education is anytime you read anything long verse, a lot of written words and so forth. That goes to education often. You have a few pictures in there. Maybe it's somewhat entertaining. And if it's good writing, you can argue it's somewhat entertaining, but that's typically considered education. Videos is way more passive, and we use more of our intellect, like our ears, we listen, we see, we feel like we're part of it, we get lost in what's being said. That's entertainment, right? And people would far rather be entertained than educated,
Even if they're searching for educational stuff.
even if they're searching for educational. Like, people want to take a passive approach. Whether you consider that conditioning, something because of all these different mediums that float around us, or if it's just innate. Listen, we were always around the campfire listening to stories, and people would reenact it with bodies. So, I don't know where the truth is exactly, right? But we know that this is what people would rather have.
People always want to take the passive approach.
Sure. At least
Interesting.
not effort. We're lazy by nature.
That gets into some philosophy.
Absolutely.
Wow. Okay. So if you were Iran, a site owner right now, what's some of the first things you would do regarding your brand? Let's say even before you get a study, like you'd obviously have a website. Would you do an Instagram, Facebook, YouTube, or is that like later?
Yeah, it would be later. Honestly, if I was to do a site, first I have to understand where I am, like in terms of what's my situation today. Like, for instance, am I going to be a sole practitioner? Am I going to be the only PI, or am I going to have a team? So that's going to determine how much personal branding I'm going to do and how much a corporate brand is important. So if I'm just a solo practitioner, well, not solo, but I've got a team, 5 or 6 people, then it's personal brand. That's primary. You can wait on developing the corporate brand, right? And I would put together a solid website that represents our philosophy, and that shows off the team as much as it does myself, but has a special page on there speaking to my accreditations and so forth, my areas of interest, because accreditation isn't always enough. Just because you come into clinical research through a certain door doesn't mean that's what you want to explore. Um, and that lends credibility to what you're doing. Then I would start exploring social channels after you have that, because you want to apply what's called a hub and spoke model. Your website's the hub for all your activity. And if you have multiple businesses, you have to decide what channels you're using and what hub you're pointing to. And this has different effects. By pointing your social media to that one hub, you create what's called what we call an Uber site. There's all this stuff having to do with SEO and so forth that track the validity of your website in terms of the Google algorithm, which is most spoke of because it's the biggest
Mhm.
search engine. In other words, your activity on other channels, if it's linked to your website, affects how that website ranks within certain search criteria when people are typing things in. You have to know too that as much as video, we like to be entertained, the web and the algorithms don't read videos. In other words, they can't read pixels, not yet, anyways.
I
So
see.
written content is very important.
Written
So
content.
written content. So once I've got my social channels done and I'm doing things on a human
For the
level,
website, you mean? Like written content for the
I'm
website?
getting there. Yeah. So,
Ah,
okay. So you're asking me how I roll this out, right?
yeah.
So once I've got my human channels, my outreach channels to the community, that that being social media. Also, you can't do it all over the web. You should be at different events and so forth in person. You're running a business now. You're not just being a doctor waiting for patients to come to you because you work at a hospital. You have to go and find business, and you have to become an entity within the community. If not yourself, a representative. So, okay, I've got that locked down. Then I go revisit the website, and this is the benefit of doing blog posts and LinkedIn posts. It's more valuable to you to do blog posts because the written content is what's going to boost your website's profile during search.
Wow.
So, and if you could tie it back to LinkedIn posts, LinkedIn doesn't like the algorithm used to work in such a way that if you linked outside of LinkedIn, it encouraged it, like it helped your status within LinkedIn. Now that has less effect, but it's still true
Stops.
that when you backlink, it's called your website to an article, it helps your website
I
rise
see.
in authenticity and importance and
So you would
self-worth.
do, in that case, you would do B2B content. Why should a sponsor pick your site or what kind
Yeah,
of,
like here's the thing. Um, you're best served if you're developing content within an area of research trials, like you pick one that you know you're going to explore. Usually that's determined by the staff you've hired, your background, and the equipment you have on hand. Like for instance, we know that eczema trials are some of the like the most predominant within research right now.
yeah,
That may change. Cancer is a specialty, right? Um, both those are opportunities to develop different types of content. That's not to say that you don't run a different kind of trial at that location, but if you're going to start creating pillar content that has ongoing value for yourself, it may as well because you've chosen a particular
hmm,
area of interest. To say you're something to everybody means you're nothing to anybody. If you try to do too much at once or in too and then what you do is once you've done that for say a year and a half, you start layering in your other pieces of interest and start growing those out. It's like growing a plant, one branch at a time.
But what would you say to those sites that say, Ivan, this sounds good, but sponsors don't choose sites based on like their LinkedIn articles they post. Like
Right.
what,
They base them on how many patients they can recruit. Why should patients trust you? It's a relationship. It's a symbiotic relationship with the patients, right?
so would the
By
articles be for the patients or would they be
They
for,
could be, they could
I
be,
see.
but you got to watch just what you can't make it like. What you start developing is content that you know to be true based on legitimate practices, existing approved research. You can start posting. Here's the thing: there's a big disconnect. The research trial happens, the data is collected, and then it dies. This is
Yeah,
your opportunity, even if it's 3 years after you've run that trial, to post if you have the rights to it, to post some of the results of that data. Like,
holy crap.
right? Like, why are we wasting that opportunity? It's why the communities thinks that the industry is so sketchy, or sorry, one of, and maybe I'm being too transparent.
There's no such thing as too transparent in our industry. Everyone's very opaque, so we need more transparency.
Yeah, but that's what it is. It's like there are various opportunities that you can identify for content development, and yeah, it's more of an indirect direct route. But marketing isn't about necessarily like your branding isn't about closing a sale today. It's a long-term investment.
Right.
Recruitment is you closing sales today. Branding is to ensure an easier conversation with your audience, right? Recruitment is about individuals, the right individuals for a particular trial. And they're both levers, like one helps the other, right? Um,
Yes, they do.
you got to build trust to have a conversation, but once you have that conversation, you have to understand,
Yeah.
you have to take the patient's perspective. You have to create the right environment for
hmm
them.
One of the
Um,
biggest
Trusted relationship.
One of the biggest barriers for patients in our community that are not referred by their doctor. So we run a lot of traditional ads too. So to speak to recruitment, in addition to branding that you saw with the videos and whatnot.
Mhm.
So we get leads all the time. And one recent lead, this happens like 20% of the time, according to my staff. But one that I was observing was this patient was texting back, this sounds too good to be true. Like I get paid to come in and it's like they think it's a scam. So then we sent them, I told the staff, send them links to our videos. Like what con artist is gonna spend money to interview businesses? Like con artists trying to hide, not trying to be out there. So send
Yeah.
them like the videos we've done with Jenny and the other one. Uh, and then once we send them those, you can almost see in their replies, they're no longer like skeptical necessarily that you're a scam. They might still be skeptical about the study for them, but at least they know you're not like a con artist anymore, which is a huge win. It's a
So
huge victory.
on a personal branding, the goal is to be a trusted expert opinion, right? For a traditional brand approach, say your clinic, okay, you're not the startup clinic, okay, we'll call it phase two, phase three of growth, right? Now you have various practitioners, one working under one banner. You need a united message. Here's the other thing. You're not as in control of your team because you've got layers of people, right? So how are you sure that you're delivering that level of care that's expected of the um, research trial? Currently, a lot of times, but not all the time, right? The sponsor is providing that guidance in the form of brochures and so forth. But you if you're a successful brand within the clinical space, you can, like, and you're um, how can I put it? Specializing in a certain area, there could be a series of things that you have to do every time that you could be putting your own materials together, and ensure that that person who's coming in for the first time has the desired clinical experience and overall impression of what it is and how it is you guys operate.
But that's
So
something you guys do, right? Like you
yeah,
help.
we help put those materials together. We trace the from the time the patient arrives to the patient leaves, like best practices, as it were. We work with clinics to do that, right? Because believe it or not, everyone goes about it somewhat differently. And that could be due to the space they're in, right? They need different materials to help guide people through a space, or just bedside. What are the top four things you want to say to someone? On a high turnover clinical research project where people are seeing patients, uh, in very quick intervals, you'd be surprised how many times people fall what we'll call off script, right? And
Wow.
sometimes it's just having a card at a desk just to remind them, right?
Yeah. Huh.
And that could affect the trial, like onboarding, right?
So Ivan, your background is so interesting. It's so important to have in our industry because you've come from industries where it's fundamental to understand how to communicate to the consumer. And in our industry, somehow that's optional. Like it's not fundamental at all. No one does it well, really, at least at scale. Oh, how bad are clinical researchers really at branding? Be as
Oh,
brutally
you're
honest
putting
as
me
you
on the
can.
spot.
Yeah,
I'd say that in terms of okay,
compared to all industries, not contextual to research.
they're terrible.
I knew that was coming.
Terrible. They're terrible because the first thing they do is think, well, I've seen a website. They're so easy to use. I got a few ideas. I'm going to throw it together. And then they do. And then they run into all these things. Well, why does mine look so mom and pop? And then they don't think of developing a brand identity, like an icon for the
Yeah.
company that has anything about it that really helps distinguish them. And then they complain that, well, we
Yeah.
have stuff and it doesn't work.
That's like ours. I mean, ours is not that great. I think the saving grace is what we do outside of it.
Well, you have several brands. Some are done better than others. This is what I'll say.
Yeah, no, but I mean like Yuma Clinical Trials, just as a site, I think, yeah. As far as my personal ones, yeah, there's some that are just thrown
Here's the thing.
together.
Here's the thing. Okay, like if you were to talk about any other social circumstance where you walk into a relationship, what you wear can determine the kind of conversation you have, like how you present
Ooh.
yourself. So why are you waiting to do that with your clinic, right? It's like an argument, oh, I'm just going to throw the lab coat on. You think that hides everything? Whether your hair is disheveled, whether you shave that day, like no, it's not enough to do the generic same. Not if you want to distinguish yourself and have a successful. And here's the other thing.
Yeah.
Brand helps you organize your ideas and have you state what you're about. And that's what you're like, that visual thing that you identify with products on your everyday shelf. That's what they do for you. Like of the plethora, like we only have room for 5 things in our brain. That's what the research says. Anything for any
Five?
particular area. Yeah, like like if you're talking about laundry detergent, or if you're talking about coffees. Typically, there are 5 major brands that people can retain. You want to be in the top 3 at very least. You don't always have to be number 1. You can be a solid number 2. UPS did it all the time. We try harder. Like there's a logic to what it is and how it is brands conduct themselves to earn trust and respect. That's all it is. They're trying to create an aura for themselves. And there is this idea
Mm.
in research that doing this is misguided or can misguide individuals. Not if you're doing it honestly. And it's hard not to do it honestly and transparently with social media. We're no longer in a day and age where people can't fact find or check if
Mhm.
people, walk the walk and talk the talk. There was a time, if you go watch that TV show Mad Men in the early episodes,
That was a
where there
good
was
one.
radio, TV, and newspapers and magazines, print, where all that stuff was edited. So you only heard what it is the corporations wanted to hear, but not anymore. Not anymore.
Not
They know
anymore.
they can't hide behind that anymore.
Yeah, a lot of work needs to be done here, Ivan. Yeah, good. There's a reason why. There's a, I think we need organizations like yours, people like you in the space to kind of guide us, best practices from other industries, because there's so many things we do well in our space, and there's so much like positives to highlight about research and life sciences, but there also, it doesn't mean we do everything right. And I think we skip a lot of steps when it comes to branding, and I think it relates to why patients don't really come to do research studies. It's like all of our problem to solve. So, Ivan, I really appreciate you coming on and doing this and uh, spontaneously doing a website review. We'll have you guys
That
work on
wasn't
our
a
website.
true review. You're asking me to shoot from the hip. There's plenty of other things I could have
I
marked down.
mean, we got enough as is, but we'll probably have you work on our website. And then if anyone wants to get a hold of you for branding purposes, for your clinic, CRO, sponsor, just reach out to Ivan. We work with him on a couple of our things, and he's definitely very knowledgeable. And as this interview could have gone another hour, but we'll save it for part 2.
Yeah, absolutely. I'd love to jump on a call. Absolutely. And maybe we take some questions from someone from the audience too, if
Oh,
we
we'll go
want.
live next time. Okay, we'll go out in the wild and go live.
Yeah, see what happens.
Okay, go connect with Ivan right now, everybody. Right now. Like, subscribe, comment, share. Catch you guys later. Bye bye.